Go ahead and get started. We want to be respectful for your time, respectful of your time. For those that I do not know, my name is Freddie Barton. I'm the Executive Director for Safe and Sound Hillsborough. We are the Violence Prevention Collaborative of Hillsborough County, and one of our strategies to reduce violence is addressing mental health and mental wellness in our community. Before we get started, I would like to bring up the chair of Safe and Sound Hillsborough, our leadership council, as I'm being told to come over this way, and I'll ask her to come over this way. We'll actually go around the front. I'm getting some instructions from the back. We have this is being Facebook live streamed. We have some people who wanted to be here but could not, so we're being told to move towards the camera. So kicking things off is the chair of our leadership council and our very own public defender, Mrs. Julianne Holt.
Thank you. Good evening. It's my pleasure tonight. I have a very small role because my assistant public defender, Marie Marino, is going to have a much more expanded role, and you'll see pretty soon what the public defender's office does in this area. But it's my great honor tonight to invite someone who, number one, I've been friends with for years and years and years. More importantly, I find him to be a tremendous partner, however, in the criminal justice system, especially in the area of mental health. He made a very exciting announcement earlier this week, and I wanted him to take the time today for just a few minutes to explain to you something that the Sheriff's Office is kicking off brand new that is going to help us in this area of mental health. And I want you to also understand that he is not only a good partner with everybody in the criminal justice system, but really a great partner with the community. And that's our own Sheriff, Chad Chronister, my good friend.
Thank you, Julie. That means the world because I tell you what, I'm such a tremendous fan watching you. And for those of you who don't know, for those of you who don't have a voice, and Freddie, I said that this down Sunday down in the Church of My Mama, you couldn't have a better role model to give those who don't have a voice. So please help me thank our public defender. Very quickly, for those of you on Facebook Live, we have pizza and beer, and I'm sorry you couldn't make it. We'll roll that in. If you lose reception, that's what it is. We're intentionally ignoring you. But yes, very exciting times. I was just telling you real quick that when it comes to priorities here at for your sheriff's office, there's nothing more important than protecting our young people, our seniors, and then mental health. You know, people ask you, what's your biggest crime issue? What's your biggest obstacle? What's your biggest hurdle moving forward? It's mental health. It's mental health calls for service. That's why we focus so many efforts on mental health. So how do we do that? And I'll keep it extremely brief. We do it with our own employees. We make sure that our employees are healthy. How can they go help other individuals if they're not healthy themselves? So this year, annual in-service training, everybody comes in and gets a good dose of a resiliency program. Knowing identifying signs, maybe their zone partner, maybe someone they work with, hey, there's some abnormal behavior here, maybe we need to intervene. And then, okay, maybe I need help, maybe my friend needs help. How do we get help? Where do we go to get help? So we make them aware of all the resources that are available for that. Next is our community, the community that we adore, the community that we serve. And that's why Madam Public Defender was just talking about, we revamped our crisis intervention training. And I call it our crisis intervention training 2.0 because it's so much better than the old version. We had 1,600 people who were trained in it, the 2,400 sworn employees that we have, and it was voluntary. Now it's mandatory, and all 2,400 deputy sheriffs will get it. That's on patrol and in our jails. Now, why is this important? It's important because they have to know how to identify someone who's in crisis and now de-escalate that individual and try to bring some calm to the situation. So I think it's gonna, well, I can't say I think, I know it's gonna save some lives. So we're extremely excited to roll this out. Everyone will get it. We have some tremendous partners from our public defender, state attorney, Northside Behavioral Services, a crisis center. The VA is now involved. And what's new to this program is it now targets veterans. So now our deputies will be able to deal, I think, better handle a situation with some particular and specific circumstances that deal with our veterans. So it includes that. How about the codependency that comes because so many people that have mental health, what do? They self-prescribe, right? They're taking drugs, illegal narcotics, because they're trying to get some type of relief. So now you have a drug-induced mental episode, someone who's in crisis. Well, a deputy sheriff needs to be able to identify that and handle that. There's a unique set of circumstances that come along with that. So now they handle that. And lastly, the new program, and there's nothing worse, a lot of you go to training. There's nothing worse than going to training, they tell you about something, a situation that happened in LA, a situation that happened in Minnesota. Well, we brought the training back to here in Tampa Bay area, where the deputies can relate to what's happening here. You know, here's some case studies that happened right here, and I think they will be able to relate to it, and I think they'll be more invested in the process by being able to identify, hey, that makes sense, that happened right here. That didn't happen in some small town in Colorado that no one's ever heard of. So a lot of what we're doing is focusing on our employees in the community, and then what's the last part of it? Is our inmates in our jails. 3,600 inmates. 33%, I would say, almost a third of our inmates are on some type of psychotropic medications. Now, when you think about this, there's 2 mental health hospitals in the state of Florida. Right here in Hillsborough County, we have more inmates, more individuals receiving mental health treatment in our correctional facility than either of the 2 hospitals. That's a lot of individuals. Now, as saddening as that is, the good part is we're making a tremendous impact. These people are getting healthy. They're getting healthy. Working with our public defender, our state attorney, you know, these are individuals who need help. They don't need jail. So getting them in the detention facility for whatever crime they committed, we're trying to get them healthy. I was just telling the Madam Public Defender that we have, for the past year now, we have a pod that's specifically designed to target those individuals who have mental health needs. Some of them are like the worst of the worst, can't be around anybody because they're that unstable. And you walk in, the chief and I took a tour a month ago, and they're all sitting around in group and they're having discussions. I mean, that's progress. So it's been great with the incentive of, hey, recover, take your medication, get the treatment you need, and in return, we're going to integrate you back to general population and you'll be eligible for release. So it's been fantastic. We just added an additional mental health counselor to expand the program because we want to help as many inmates as we can. Like I say, a lot of times we can't control why you're there, but we can sure make sure you're healthy while you're there and help you integrate back into society. So, and with that integration, now we're working with a re-entry program, and I hope I'm not stealing all your thunder tonight. You're going to not have anything to talk about. But with the re-entry program, we just got a $750,000 grant from the county. And the county grant is designed to help individuals, the worst of the worst, that have mental health and codependency, and is to take them, use the counseling and the treatment that's available from the crisis center, from whatever services that they may need, DACO, and get them the help they need and help them re-enter back into society. And I think that's going to help a lot of individuals, because if they're healthy and we're making them even more healthy, we won't see them again in the jail system. We won't see them again in a call for service, and let them be healthy to be productive members of society. So a lot going on when you talk about, hey, do you have a focus on mental health? We sure do. But again, more importantly, just wanted to announce the new program that we're launching. And lastly, I just want to take just a quick moment to thank Safe and Sound. I don't get here enough. Thank you for what you do. Thank you for everything. We're making some tremendous progress here in Hillsborough County. Thank you to all of you. While a lot of people are home right now, it's raining, they're watching their favorite TV show, eating a meal, hot meal. You guys are here. Thank you for being the individuals in society that step outside the shadow and say, I want to be more involved. I want to make our community better, because we know if we build a stronger community, we're going to have a safer community. God bless each and every one of you.
All right. Before we go on, I'd like to recognize a couple of other members of our leadership council here who make my job a lot more easy to do function, even though they beat me up all the time. So we just heard from our sheriff. From the sheriff's office, we also have Chief Deputy Donald Levinsky. Agent Thomas St. John. From Temple Terrace Police Chief and Vice Chair of the Leadership Council, Kenneth Albano. From Plant City, Sergeant Al Van Dyne. And Dr. Kathleen Heidi from USF. This is a shameless plug. Safe and Sound Hillsborough does the work that we do the work that we do because of the partnership of the members of the Leadership Council, which include the Board of County Commissioners, all 3 cities, the mayors and police chiefs of Tampa, Temple Terrace, Plant City, the state attorney's office. Our state attorney, Andrew Warren, will be here a little later. The public defender's office, the 13th Judicial Circuit, the Children's Board, the school district, and the sheriff's office. And most importantly, you, the members of the community. We cannot do this work alone. It takes a connected village, just not one village. Part of that village is one of our recently added members of our funding base, as well as a community partner, Anthem Foundation and Simply Healthcare, who just awarded Safe and Sound Hillsborough a planning grant to launch mental health first aid training all throughout Hillsborough County, and representing them is Darlene Grant. Thank you for your partnership and your money. And now I will turn things over to the person who really helped put this thing together, the chair of the Family Health and Wellbeing Committee, Mrs. Marie Marino. As she gets ready to take the mic, we just want to make sure that if you have not done so, please look at the screen. There are some instructions. We will be asking some survey questions pre and post, and we'll be able to see the results live. For you watching on Facebook Live, you too can also participate in some of our survey questions as we have this listening session on Youth Baker Acts. Even though we've labeled this as a listening session, we want to listen from you, the members of the audience. So we have cards that are going around. If you have a question for several members that are here on the panel, and we're going to have members of the Family Health and Wellbeing Committee, please come up and join us here at the dais so that you too may be able to answer some questions. We'll keep things going. We'll have people picking up cards along the way and asking your questions for you. And with that, Marie Marino.
Thank you, sir. What a joy to see most of these seats filled, and I anticipate and hope by 6:30 they'll all be filled. I don't get any credit for this, folks, because my committee, the Family Health and Wellbeing Committee, is the most active committee in Safe and Sound. They participate in every meeting. They care deeply about what's going on in our community. And I would ask those on the committee to come sit up front so we make room for folks in the audience. And just so everybody knows who you are, your involvement, and if you can help in this discussion, I really appreciate you being willing to do so. So come on up. I see your faces. I don't want to call you out. Thank you. Thank you, Pam. Thank you, Liz, Patrick, Daco, Antoinette, or Marilyn. Please. It's a good start. Lori, you can join us. You're a committee member, State Attorney's Office. So thank you, everybody. So it takes a village again, and I just want you to know that present with us today, volunteering, because they stay on the periphery at all times and care deeply about what we do, is USF. And we have 2 professors from USF, 2 doctors that volunteered their time to be with us tonight to facilitate our listening session. And I'm very pleased to tell you that Dr. Christie is here, and she has put together this wonderful PowerPoint presentation that took data and that took a lot of work on her part so that we can have a small education component to what we're going to talk about tonight. And of course, we have Dr. Moore. Dr. Kathleen Moore is actually our new executive director of the Florida Mental Health Institute. So we are so fortunate to have them right in our backyard, participating, volunteering their time every day, so that we're educated. We have data, we have evidence-based practices behind all the things that we do. So I am going to hand over the microphone to Dr. Moore, and we will begin.
Thank you, Marie. How's everyone doing?
Good.
Hopefully a little drier than we have been in the past week, right? Thank you all, as everyone has said, thank you so much for coming here tonight. I know that there's probably 10 other things that you could be doing tonight, but this is really important for our community. And this is our first listening session that we're going to be having. Hopefully we're going to be having more of these through Safe and Sound. And this first one is going to be focused on, as we said, the Juvenile Baker Act system. I know that it takes a lot of people to make the system work, including our CSUs, our law enforcement, our schools, and our treatment providers. And so we know that a lot of you are in the audience
this evening, so we really appreciate all of your work because you go above and beyond. We know that this is a really important population. Our children are going to be our next citizens of our community, our adult community, and we want them to be safe, we want them to be sound, we want them to be healthy, and oftentimes they're not. And so I know a lot of you work with them a lot to make sure that they can be. And what we want to do tonight is listen to those of you that may have been involved in that system. The parents, the youth, the community, the teachers, we want to hear from you. And so one of the things that the conversation is intended to do is to educate, right? So we don't know everything. We want to hear from you. We want you to hear from us. And we want to be able to share those lived experiences of our system in order to identify some gaps and some challenges in our system. We want to look at the strengths, we want to look at the weaknesses, and we want to look at some of our underlying policies and how we can maybe better that. So that's really what we're here to do tonight. This is an hour, right? So we know that we don't have a lot of time, so we want to make sure that we utilize that time as much as possible. Before we do begin, as Freddie and Marie mentioned, we do have a couple of questions that we're going to ask in the beginning and at the end, right? So we want to see if there's, if we're changing or adding to your knowledge base. And so I think we had put the, there we go, how to join. We put this slide up in the beginning, so hopefully everybody was able to do this, either through web or through text. Has everyone been able to join in? Any issues? No technology issues?
Yeah.
Yes, okay.
I'm not sure you saw that.
Okay. Okay. We'll do a test. So Freddie's going to help us with a test question. So the question is, do you like donuts? Yes? Great job. Or is that a cop joke? Majority like donuts. Are we good to go for the first question?
We've got a few more participants that have to answer.
Okay.
3 more. Oh, they're flying in. So we'll skip the sandwiches next time and just bring the donuts.
There we go. There we go.
All right, we're ready for the next question. All right, now that everyone's pretty used to this technology, and it's very cool because not only do we get a chance to see this live, but we'll be able to instantaneously download this and report it back to all of you.
That's great. Okay, first question. Do you understand how the Baker Act works?
One more second. All right, moving to the next one.
Second question. Do you know how or where to get help if your child or family member is in crisis? Third and final question. Would you feel comfortable if you had to use the Baker Act? You can only answer yes or no.
Yeah.
A little more variability in this question.
Give me one second.
Thank you. As Marie said, I am the FMHI, which is the Florida Mental Health Institute Executive Director, and one of the things that I love to do is events like this. So we do a lot of work in Ed and I in our at USF in our offices, and we crunch data and do research. But what we really like to do is come out into the community and talk about our research in a way that makes sense, and bring it to practice, and then have practice informed research. So it's really a collaborative effort that we do with all of us, and then we want to also include policy. So we hope that we can do that tonight. And one of the things we thought that would be helpful to do is talk a little bit about some of the data. Dr. Annette Christie is the director of the Baker Act Reporting Center, and she's going to talk a little bit about some of the data that we have within Hillsborough County, some of our surrounding counties, and then Florida statewide. And then we'll come back and introduce our panel members. So without further ado, Dr. Christie.
That's our website. Our fiscal year 17-18 report is under review. We're hoping it comes out in a few weeks. So if you go to our webpage, it'll be down in that lower right corner when it's released. That's the one before this up there. So I'm going to go to the next slide. So I could, as some of you know who know me, I could talk for an hour. I'm going to talk for about 5 minutes. So if you have questions, you can email me or give us a call. Our number is 813-974-1010 at the center. And so one way that we look at the data is the rate per 100,000, because that way we can compare counties, right? Because the population of counties is not the highest there. So to give you a sense of the rate. Does that surprise anybody, or don't know what to think? Okay. And I know this is pretty quick, but these are just sort of the numbers of the exams. You know, the rate puts it within population context, but these are just the actual accounts of Baker Act exams. The data we get come from the Baker Act initiation forms, the BA 52A that law enforcement fills out, the BA 52B that health professionals fill out, and then about 4% statewide are via ex parte order of the judge. And so these are not admissions, they're examinations. Not everybody that has an examination is actually admitted to the receiving facility. And so the column on the right shows the percent change to the most recent year. All right. So this shows the type of professionals that initiate. So for adults, it's almost kind of 50-50 for health professionals and law enforcement, with a few that are ex parte. But for children, it tends to be more law enforcement. Now that doesn't necessarily mean that law enforcement is that the law enforcement officer is the one that actually started the process. It could be somebody else at a school or somewhere else, and then a school resource officer is called in. But that's the form that we get, BA 52A, so that's what that means. It was initiated using that form. And then if you look at the 34.9% that are initiated via health professional, it breaks down the type of health professional. So the physicians that are not psychiatrists, we think those are mainly probably ER docs, licensed mental health counselors, psychiatrists, and you can kind of see on down. So on the forms, there's harm type, there's evidence type, and then harm type. So in order to initiate a Baker Act exam, there has to be evidence of mental illness, and that's defined in the statute. And then there has to be evidence of harm to self, harm to others, and or what's called self-neglect, and those are defined also in the statute. So this is the green on the left is showing you for children in Hillsborough County for fiscal year 17-18, that about 74% were based on harm only, the self or others. And the next slide, we're going to get to the harm type. And then in the sort of tan box, harm and self-neglect. So if you combine those two, the vast majority of the Baker Act exams have self-harm in them. Self-harm is not necessarily synonymous with suicide or suicide attempt, however. There can be other behaviors that sort of fall within that. Want to go to the next one? Oh, you did. Okay. So this is harm type. So harm to self only is on the left in the green, and then harm to self and others is the tan box. So this is sort of a breakdown of those that have harm as a type, the harm type. Next slide. So that's kind of the speed tour of data. It's probably as fast as I can go, but I will be glad to talk to any of you. If you want to look at our annual report, we have lots more that we can show you.
Great. So now really for the heart of the event is talking with our panel members. And what we'd like to do is we have 4 panel members. We have Deputy Stephanie Prager, Carol Loyan, Mr. Derek McCarran, and then Dr. Ann Townsend. And I'm going to introduce each of them and then pose a question. And then they're going to respond to that question. And then we're going to open it up to some of our community questions, right? So first I want to introduce Deputy Krager. She is with the Hillsborough County Sheriff's Office, and she's a deputy with CIT. And your question, Deputy Krager, is, what is the role of law enforcement in a Baker Act, and are there specific issues related to law enforcement Baker Acts of our UP?
Hello, everyone. Can everyone hear me?
Yes.
Right. Basically, the role of law enforcement is we respond to emergency calls. So we're the 911. So when someone has an issue, we respond. So we're first responders. We handle a crisis that's occurring right now. So when someone calls 911, law enforcement responds, and we problem solve. We try to figure out what's going on. So when we respond to the house, the first thing we're looking for is for our safety and the person's safety. So family, the person that's in crisis, that's what we're looking at. We're checking the area. So if you see deputies kind of looking around and trying to check it, they're looking for items that could hurt them or hurt others in the household. So just be, when a deputy comes in the house, that's what we're looking at. We're making sure everyone's safe because we know they're there. We're there because someone's in crisis. Then we start talking. We talk to the family, we talk to whoever's there to figure out what's going on. And then once that happens, we determine whether they meet criteria. That means the Baker Act criteria. Are they a threat to themselves or others? Or if they're neglecting themselves and they're not able to take care of themselves on their own. So we look at the situation, we ask them questions, we ask the family questions, and we make the determination. Now, we're not licensed clinicians by no means. So we're looking at the situation right then and there and trying to figure out what is the best course of action. So 9 times out of 10, if a person threatens to hurt themselves or someone else, we're gonna take them into custody. And that means, yes, unfortunately, putting handcuffs on that person and putting them in the backseat of our car. Do we want to do that? Absolutely not. It shouldn't be part of our job, but unfortunately it is. This is the day and age that we're the ones that are responding to those people in crisis, those children in crisis. So once we do that, we complete the paperwork and we take them usually to Derek at Grace Point Children's Crisis, and then hopefully they can figure out what's going on with that child. We also have TransCare, it's a 211. They actually do our Baker Act transport. So if we feel comfortable enough and the person is safe, we will call an ambulance service to come pick them up, which is a little bit less, for that person to understand that they're getting inside of a police car instead of in an ambulance. So we do have that ability. It is a contract through the county. Any agency can use it, so that's also an option. For family members, just kind of a thing, if you call 911 and your child or person in your family is having a mental health crisis, tell the dispatcher. Please ask for a CIT deputy. We're trained for those responses. If you ask for a CIT deputy, you are guaranteed to get a CIT deputy. We have a lot trained, as the sheriff said. We have over 1,600 deputies trained in CIT. They can de-escalate and try to see what resources we have available.
Thank you so much. Next up is Ms. Carol Aloian, and she is the Consumer and Family Affairs Director with Central Florida Behavioral Health Network. She's also the past president of NAMI Hillsborough chapter, and she is also a parent. So her question is three-pronged. When was your child first diagnosed with a mental health disorder, and what steps did you take toward receiving help and healing? How did you and your family begin the recovery process? And then finally, how's your son doing today?
Thank you all for coming out. I appreciate that. So my son was first diagnosed in 1999. 1995. He was 10 years old and in the 4th grade. He was always very active. However, we're Italian. He's a boy. We always had excuses to him being active. However, in 4th grade, the teacher recommended that we see a counselor or we see a psychologist because his behaviors were causing him a lot of distress in his grades being lowered. And so we brought him to a counselor, and he was diagnosed with ADHD. At that time, my husband and I decided that we would not put him on Ritalin, which they had asked us to do. Because again, he was 10 years old and his brain was still growing. And we looked up some studies and we really didn't see anything that reached out far enough to say how safe it was for someone to use that medication over a long period of time. So we opted to do something different. We took parenting classes. We also learned some skills to help him with learning disabilities, and that's what we opted to do. However, as time went on, his energy continued on, and he started getting into trouble. And the loss was actually involved at that time. So by the time he was 16, he was self-medicating, as Sheriff Chronister had mentioned earlier. And he wound up in a juvenile detention home. We decided that, of course, by then he would need to be on medication to help him to not self-medicate himself. And also by then he was also diagnosed with bipolar disorder. So the next question, he had been Baker acted and Marchman acted about 13 times by his 18th birthday, which is a lot of times, and you might wonder why. But that's a lot of it has to do with his illness, self-medicating. A lot of it has to do with even parenting skills and stigma. Because of the stigma, we didn't reach out to many of the services that are out there by our own choice because of the stigma. And also, there's different philosophies out there, so every counselor that we went to, we got a different opinion as to how we should parent our child. So it's very confusing. So the next question was recovery
today. Yeah,
Okay.
recovery today.
So recovery came about through National Alliance on Mental Illness, and there's a table over here. Please go see them. They had a 12-week class. My husband, my mother, and I, we took this class and we learned a lot about the illness. We sat in the class and we're nodding our head to some of the things that we were learning. We were watching other parents nod their head, and we discovered that this is a real illness, that this is not just behavioral issues or parenting issues. This is really an illness. And we learned a lot about the symptoms and a lot about treatment. And so with that, we also joined their support groups and their advocacy groups. And that really helped us to become more engaged in his own treatment. How is he doing today? Today he is 33 years old. He's doing very well. He has been on and off his medications for many years. It's like anyone in here, you're not feeling well, you have a sore throat, you take an antibiotic. After 3 or 4 days, you feel good, you take yourself off, maybe because you had a little diarrhea or something else that doesn't feel so good, and you wind up taking yourself off a medication that you really should have been on. And you could wind up getting sick again. So this happens a lot to individuals who take these strong medications. They're either nauseous or it takes a lot out of them. So he has been on and off his medications for many years, but recently he had his first episode with jail as an adult. And now he is forced to take his medication. And being that he's forced to take it, he's doing really well. The medication shows that he really needed something to help stabilize him. We also hope that as he moves forward in his own recovery, that he will recognize the illness and that he will continue to look for his own treatment and his own recovery pathway.
Carol, thank you so much for sharing. I'd like to introduce next Mr. Derek McCarron, who's the director of the Children's Crisis Services Center and is the program director here in Hillsborough County. Your question is, what is a Baker Act receiving facility and what is your role in the community?
So to dispel a few myths about the correctional receiving facility. We are sometimes interpreted as some sort of residential program, to which we're not. We are what you would consider an emergency room for sudden onset mental health crisis. So we often kind of share with individuals that, you know, we get the children that no one else knows what to do with, whether that's in private practice, whether that's in the community, or whether that's in the emergency room. And the challenges we have with that, you know, we have to operate 24 hours a day, 7 days a week. But we do have a philosophy of, you know, anybody that comes to visit us will absolutely, if they're not staying, they will absolutely be linked with services, because it takes a lot of courage to come through those doors, because a lot of people don't know what to expect. And the challenges with that is we usually have to educate a lot of our families on what the journey may look like. Because sometimes folks will say to us, but they were here for 72 hours and you didn't fix them. And we're like, okay, well, this is going to be a journey. This isn't going to be take 2 of these and you'll be just fine in the morning, right? We service about 3,000 children in a year. You know, in the grand scheme of things, you think, well, that's a lot of children, right? That's a lot of families, right? That's more alarming. That's a lot of families, and there's usually other children in that home that can be exposed to high-risk behaviors. And the challenges you have with that are quite a few. There's socioeconomic, there's limited access, timely access to outpatient services, to which we try and remove the barriers for, whether they stay with us or not. When a child comes to us, we get him an appointment within 7 days of discharge for therapy. If they're prescribed medications, they will get an appointment within 29 days. Why is that? Doctors prescribe 30 days worth of medications. So we would like you to get there before you run out of medication. The other philosophy we have is we do look for the least restrictive environment. So Dr. Chisty had a really good point when she says, you know, you see these high numbers of Baker Act being written. Does not mean to say they're all being admitted. We have about 22 to 28% diversion rate. And that goes for our other partner in the community as well. They're very close to the same diversion rate. So the goal of our facility is, when in crisis, we welcome you to our facility. We try and reduce that crisis through a number of different means, whether that is you're going to meet criteria to stay, or you don't quite meet criteria to stay, but we recognize the importance of getting you linked with services. And we offer those folks the same appointments we offer the folks that are being discharged from our facility. And we're very fortunate in the relationship we have with our outpatient department and some of our other community stakeholders. And you know, the big thing that we've seen, we moved from a 14-bed facility 2 years ago to 28 beds. And we're about 100% utilization rate for 10, 11 months out of the year. We're also getting requests from other parts of the county, like, you know, your Polk counties, your Pinellas counties, your Hernando County has 0 children's beds. So we often say to ourselves, well, we can help out another county and provide some support for those guys, we will. But Hillsborough County, for me, comes first. You know, and we have a large school-age population in this county. We're the 8th largest school district. That's a lot of children with a lot of needs. You know, and we are often, you know, when I first started this, we used to be considered maybe the 3rd or 4th intervention for children. There were a lot of intermediate services prior to us. Now I could honestly say we're either number 1 or number 2 when a child's in crisis. Does that answer?
Very good.
And then our 4th panel member is Dr. Ann Townsend, and she is the Supervisor of Psychological Services at Hillsborough County School District.
And in an effort to truly self-disclose, I owe USF a dissertation. So Ms. Marino has kind of promoted me and conferred a doctorate degree. I am his counsel, but I do have to disclose that. I am representing student services with Hillsborough County Public Schools, but also representing the district as a whole, because your question does address counselors, teachers, and others that will be involved in supporting students. So I'd like to very briefly, in the time that I have, talk about our three-pronged method of supporting students. One is looking at our prevention efforts, two is looking at our intervention efforts, and three is looking at our follow-up and in some cases post-vention efforts. So starting off with intervention, it is very important to us as a school district to make sure that each child feels that they belong, that they're part of a community, and that there are relationships that are built among themselves as students, as well as with trusted adults. So we have partnerships with Sandy Hook Promise. Some of you may have heard of Start With Hello, the presentations that are being done kind of district-wide. Sandy Hook Promise is helping us with that. See Something, Say Something, and we're pairing that up with our Act Now, where you acknowledge, and you show that you're alert to your friends. You tell someone if there's an incident or a concern that you have. And I put the C in the middle. The C is to care. So acknowledge, be alert, care, show you care, and T, tell someone. We want students to act now. And so what we have done over the course, in particular of the last 2 years significantly, is work on our efforts to train not only our student services personnel in the form of school social workers, school psychologists, school nurses, and school counselors. You all probably know them as guidance counselors, but we do call them school counselors. We've trained them with preventive methods, with protective factors, resiliency factors. What can they do to build those relationships with students? We then asked them to go out and train the teachers. So teachers were trained with 1 to 3 hours, giving them information from a homegrown, built program that we vetted through FMHI with Stephen Rodenbaum, as well as with Dr. Scott Pullman with Nova Southeastern University. So after training teachers, we then went and had student rallies. In some cases, student assemblies, and in other cases, we had small groups in which students could see and hear from trusted adults what are the signs that they should be looking for. How can they protect themselves? How can they speak up for a peer? So it's very important for us to make sure that we empowered students to say, something's going on with me or something's going on with a friend, and I want you to speak up. These are the trusted adults that we can go to. We do have situations in which children do have, I would say, instances in which they express self-harm. So we heard some of Dr. Christie's data, or express a desire to harm others. It happens. So we want to make sure that we intervene, and we want to make sure that we intervene following a protocol. So we do have a suicide prevention protocol that we follow. We have a threat assessment protocol that we follow, and our student services personnel have been trained on those protocols. They involve school resource officers, school resource deputies, and also involve parents, because we want to know, what is the child's history? Does the child have maybe access to a means by which they've expressed suicidal ideation? And so we want to also make sure that we're able to provide referrals to individuals within the school district as well as our partners within the community, because we want students to get the help that they need. Hillsborough County Public Schools does not Baker Act students. Hillsborough County Public Schools follows a protocol, and we do everything that we can to support students, but the protocol that we follow entails collaborating with local law enforcement agencies for them to then implement their protocol and determine whether or not a student is Baker Acted. So I know there's a lot of information out there that might be a little confusing or misleading, but I feel like it's important to share that we partner with local law enforcement agencies for the Baker Acts to occur. I think, did I answer the question? Was there any additional? Yeah.
Now what we'd like to do is have some community questions. We already have some, but did anyone write down a question that I can take? Okay. For school?
If you have questions, we've passed out some note cards. Please make sure you write your questions down. We have Rose and Sneecia who are walking around. Just raise your hand with your card, and we will collect them and make sure your question is asked.
Thank you so much. So this question is primarily for school. I was recently called as an advocate to accompany a parent to her child's middle school. The parent wanted the school to receive a notarized document that the school would not Baker Act her child without first contacting her. I understand that such a document must be approved by the Board of Education. How are you addressing fears, and is there protocol for Baker Acts in school? Will you address some of that? Because when I was at the school, I was told there was none.
So our protocol for suicide prevention has been in place probably for 18 to 20 years now, with revisions that have occurred at different points in time. We encourage parents to be part of the process through every step of the way. So looking at our preventive measures or prevention measures, as well as intervening. So we don't know what a child's history is. We don't know if a child is receiving therapy outside, if the child has expressed they have access to a particular means by which they want to harm themselves. We don't know if they have that access at home. So parents are partners in that process. So we do contact them, and part of our assessment means not just notifying a parent, but partnering with them and asking information that would help us so that we can plan together.
Can I follow up? When I was at the middle school, I was told that there was no protocol in place, and that I was confident that the counselor would do everything possible to contact the parent. But I did ask her, if you were to leave, would your successor be aware of the protocol? And we had this huge discussion about next school year and ensuring that parents, students, teachers come to some understanding. And on the reverse, I said that the parent's concern is that her daughter had autism, and she was afraid that some of her daughter's behaviors would be misinterpreted, and then the child was then Baker Act.
So very valid concerns. But the first I would like to share with you, reiterating again, there is a formal protocol in place, which again has been vetted. And I'd be more than happy to, maybe we can have a conversation afterwards. But you bring up a very important point. We work as teams. So a school counselor, a school psychologist, a school social worker would never work alone in the process of implementing the suicide prevention protocol. And when we're looking at students' needs, we have to look at their individual circumstances, right? Individual factors. And in this particular case, with students who have autism, we know that sometimes they exhibit behaviors or make statements, which we might need to look at in a different way, but we don't want to ignore. So in that case, it would be appropriate for not only that student services team to assemble along with the parent, but also the IEP. If the student has been identified and has an IEP, an individual education plan as a student with a disability, then it would be important for that team to work together as well to identify appropriate goals and objectives to continue to work with the parents, with the student, with teachers for support of the child.
Thank you so much. So this next question is a funding question. How has the Baker Act been affected by the amount of funding given by the state? I'm going to open it up to any one of you.
I'll answer that.
Okay.
It's Dan McDonald, Tampa Police Department. Last time I checked, Florida ranks dead last in the nation, 50th out of 50th in mental health spending. So the good news means we have room for improvement. The bad news is that it has to be a priority. I'm going to steal a good quote I heard last week at a conference. We are all here preaching to the choir. I think, or hopefully by the end of the night, everyone will realize the value and the challenges we have as a community. But we need to expand the choir to the rest of the community. This is a community issue. It's not a police issue. It's not a courts issue. It's not a public defender issue. We need to expand this to the rest of the community. And it has to be a priority, so why shouldn't we be number one in the nation in mental health spending per capita? It has to be a priority, particularly with our funders and our legislators, elected officials and funders. So get out there and make your voice be heard and expand the choir. And we need a big choir to preach to.
Carol?
As I mentioned before, National Alliance on Mental Illness, we have a table over here. We do have a group, it's called NAG. It's the NAMI Advocacy Group, so very appropriately NAG. And we meet twice a month, and what we're doing is we're advocating for dollars. We're advocating for better services. We're advocating for recovery and treatment and supports within our community. So we encourage you to join us.
Thank you so much, Carol. Before we get to the next question, we just want to acknowledge Judge Elizabeth Rice, who is with the 13th Judicial, who is now present. Thank you, Judge. Yep.
In light of a significant tragedy which occurred in the state, February 14th of 2018, Marjorie Stoneman Douglas Public High School Safety Act was enacted about a year ago. And as a result, all 67 counties within the state of Florida have been given allocations to support mental health. Hillsborough County was given $4.8 million as a school district so that we can provide additional services to students, have partnerships with our community agencies, and while I personally think 4.8 still isn't enough, I think it's a start. These are hopefully recurring funds, and that we do have a mental health plan in place with these partnerships so that we can support students who may not have the means to have some of that mental health support outside of the school setting, as well as partnerships bringing supports within the school settings.
Thank you so much. All right, our next question, I think probably Derek, you can answer this one. What percentage of children that are Baker Acted are not released within a 72-hour period due to concern of harm self? And if they are not released, then where do they go? They remain at the CSU, or do they go somewhere else?
So I'll just, since we have a public defender, so as all my wee ones like to remind me when they stay past 72 hours, Mr. Derek, I have a lawyer. I go, yes, you do. Yes, you do. So it's not something that we can just kind of do on a whim. You know, for the way our facility practices, if we're going to extend a child's stay with us, we have two psychiatrists give a first and second opinion as to the medical necessity for that process, because we don't take it lightly. We are the most restrictive environment for treatment. So when, you know, that's the first part of it. The second part of it, there's a very small number, very small percentage that actually stay past 72 hours. And I try and share with folks how much gets done in one day at a Baker Act facility, from getting collaterals from parents or protective services or calling abuse reports, to seeking records from other facilities that have received treatment. And you know, we'll move to these electronic records now where everything is far more accessible in a far more timely fashion. So I used to kind of share with some of the folks that had just kind of started with us. I go, years ago when we had paper charts, right? It would take you 6 months to get a paper chart, this thing, you know, with psychosocials and treatment plans and doctors notes. It's that thick in 3 days, right? It's not that thick visually. I mean, it's now on computer, right? But that's what it's like. I mean, we are non-stop for 3 days. And the seriousness of extending a child's stay with us is very, very prominent in our culture, you know, as far as we're not going to keep them unless they meet medical necessity to stay. And, you know, the longest we've kept a child, and this was a child that had been to the ICU 4 times, right, was 28 days. We were waiting for placement at a residential facility. And when they got to that residential facility, they had another significant attempt on their own life 3 weeks later. So we do take it seriously. We do need to keep them, we do. But the legal system is involved. Parents are involved. The child is made aware of why we're doing it. And, you know, it's something that I think is another misconception, that we can keep children longer than the 72 hours, and it's just not the case. You really need medical necessity to be able to do that. Does that answer the question?
And as a follow-up, in other other providers on the panel can chime in as well. What outpatient services are available after they leave?
I had shared earlier that any child being released from a Baker Act facility, they get an appointment within 7 days of discharge. And the first day of discharge is included, right? So really kind of 6 days after they let go, they have to get an appointment. Now, whether that's a therapy appointment or a case management appointment, they're getting linked up with some community-based programs based on their discharge summary. If they're prescribed medications, they will have a psychiatric appointment within 29 days. We have an MOU with the school that if the parent and child sign the release, the school will engage them in some way, shape, or form within 12 days of discharge. Because we find that 30 days after discharge is really critical to keep them engaged in services. Now, if we have someone that's, as we call, a little bit more of a high need, high utilizer, they've had multiple admissions, we will look for some more intensive services rather than your traditional outpatient. I'm fortunate enough that I'm over some other programs that can provide that. One of those is a CAT team. Their sole purpose is to prevent children going to residential. Yeah. Oh, community action team. When you work with them every day, you kind of just use that acronym. And they can keep these children, and they absolutely treat the families as well for 9 months. But there's only 35 slots available. So they don't have a lot of turnover in services. So we have to really screen out the kids that could really, really use that process. And there has to be some attempt to use outpatient services, right? So we do warm handoffs in those situations where, as the patient's being discharged, we will have that family meet with that program right in our building, and they use our family session room to open them up before they've actually went home. Because we found with certain populations, the further they get away from the crisis, the more challenging it is to re-engage them. So that's, and then yeah.
Thank you. Hey, I'm Pam Jeffrey. I'm the Executive Director at Success for Kids and Families. We are a local nonprofit that serves the mental health community, primarily children and their families. We have programs that are funded through a variety of wonderful funders, including Central Florida Behavioral Health Network, Medicaid, the Children's Board, school districts, several others. And so we can provide mental health services to children as young as maybe 5 and all the ways up through parenting adults. And so we have a variety of programs and lots of partnerships that enable us to really provide a wide array of services to a family. It's our philosophy to serve the entire family. When we get a referral, a great partnership with Derek at the Crisis Center to receive referrals on clients that maybe they can't serve, specifically the ones that are unfunded, because we're fortunate enough to have the state funding through Central Florida Behavioral Health Network to provide mental health services to those clients. Those children and families that are unfunded, meaning they don't have insurance. And so we can provide a whole lot of services. I could go on and on, there's lots of other partners here. I did bring a big old stack of brochures, they're on the table over there, so if anybody is interested in learning more about the services that we have, our brochure may help some, but I'll be available afterwards to help also.
Can you repeat the name of the organization?
Sure. Success for Kids and Families. Okay. I tend to talk real fast, I'm Italian also. Talk with my hands and a little too quick.
I'm Antoinette Happy with DACO Behavioral Health, and like Success for Kids and Families, we have a strong partnership with all children's services in Hillsborough. Some of our work involves intensive outpatient services as well as traditional outpatient services for kids. But we also have a long history of working in the schools, doing prevention work and identifying kids through the school system and working with the families to support them. Traditionally, a lot of our work has been in the field of substance abuse and, of course, prevention of substance abuse. But in the field of mental health, we look at it as behavioral health. And so the work that we do is behavioral health in focus, with addiction as our specialty. So when we have kids who have identified mental illness in the school district, and we're kind of screening out for substance use issues, when we identify them as having what we consider a dual diagnosis, we appropriately refer them to another partner, or in many cases, because we're well equipped with our staff, our staff are primarily licensed mental health counselors, social workers, and master's level clinicians. We do the work with them, and our referral goes in both directions. So sometimes in working with the kids who've been identified as self-medicating a mental illness, they come to us with an emerging substance use issue. And sometimes in working with them through their use issues, they end up in the Baker Act facility, or we ourselves have to initiate a Baker Act. So it goes both ways. We're referring to them, and we're also receiving from them kids who need to be stabilized at intensive or other levels.
Thanks, Internet. Christy?
Hi everybody, I'm Christy Thomas. I'm at Northside Behavioral Health Center. I apologize, I was a little bit late, so I didn't realize I was supposed to be joining my fellow committee members up there, so thanks Dr. Moore for coming to bring this to me. But over at Northside, we do provide outpatient services for children. We do counseling services, group services, family counseling, and then we also do psychiatric services for kids as well. Ditto what was said by my fellow committee members. Basically, we're all first name basis with each other. We know that if we have a need that we ourselves can't provide, we ensure that we reach out to those that can provide those services for us. So as large and as difficult sometimes as it seems to maneuver this county, what I can say is that we work very, very well together. So it's great that we're able to have something such as this, a forum like this, where we can make sure that those that live in this county are aware of who we are and what it is we do. We also have some brochures available outside over here, and we'll be hanging around afterwards as well if you have any questions for us. Thank you.
Thank you so much, Christy.
So this next question is, I think, primarily school and law enforcement. Are parents notified when a child is admitted under a Baker Act? And who is responsible for this notification? Is the sheriff, police, or who is making this decision? Law enforcement, schools? So I'll turn it over to one of you.
You want to talk about the school and I'll talk about mine?
Sure. So again, speaking in terms of the protocol itself, protocol requires that we have a partnership with parents so that we can collaborate together in terms of sharing information. There may be some circumstances or instances in which we may not be able to get in touch with the parent. However, the law does require within a certain period of time of the child being Baker Acted, that the facility notify the parent. So I mean, Derek can probably speak a little bit more to that.
Law enforcement tries to contact family members, but sometimes we can't. What we would rather do is if we have a family member or parent that is very involved in their child and we believe that they will be able to take care of that child and get them into services right away, we try not to Baker Act. We try to find other avenues because that's, really, as Derek said, it's an emergency room for someone in crisis right then. If we can talk to that family and we can confirm that they will get this child assistance, we'll leave it up to the family and go from there. Like Ann said, basically we try, but sometimes the child doesn't give us the right phone number, or nothing's been updated in the system for how to contact that family member. So we do try, but unfortunately sometimes it does not happen.
So, kind of to piggyback on what Stephanie shared, based on the information that gets presented at the Baker Act, if the parent's not with them and that information is accurate, and the child doesn't have the cognitive ability to kind of share with us their mom's phone number or dad's phone number or auntie or grandma, because not every child lives with their biological parent, right? What we'll try and do then is kind of contact law enforcement again, maybe have someone go out to the home so we can have someone kind of have that parent call us. But it's one of the first things we do as a child comes in, we verify the information, and then we try and reach out to that parent. Because we've had instances where parents have been waiting at a bus stop for their child, and the child not got off that bus. So our staff are really, really aware of how important that call is, and as quickly as possible. But it can sometimes come down to just tracking down the right information. It's not a matter of people don't want to reach out to our parents, we don't have the right information.
Thanks, Darren. So this next question is really for all of our panel members. How do we address the stigma, the mental health stigma that is associated with getting help? And we talked about this a little bit, but this ranges from our child to our parents to our community. How do we deal with this?
I'll take it for, Carol, do you want to speak? Why don't you speak, Carol?
For one, education. You know, as a NAMI member, National Alliance of Mental Illness for Hillsborough, you have to be educated in order to move forward, in order to go towards recovery. So that's really the top priority. Stigma is related to myths. That's what it's related to. But when you're educated, then those myths go away and you can speak truth. And that's what needs to happen.
One of the things that's happened for our agency, but I believe that it's representative of our whole field over the last number of years, is the emergence of really valuing people who have had the challenges of mental health issues or behavioral health issues, and really empowering those people to speak out and to help others. And so our agency, and I know many other agencies here, employ what we call peers. And it's especially been a wonderful tool for us with the youth population, you know, with the older teenagers and young adults, because they don't really want to speak to me. You know, I'm like this old, you know, chick who doesn't really know what their life is like, but they're thrilled to talk to my 24-year-old staff who has themselves maybe struggled with their own challenges and is willing to share that and say, come on, come to group. I'll meet you outside. I'll walk in with you. I'll sit with you. And we found at our agency that those staff members have been invaluable to our engagement rates, to families becoming involved, you know, just being able to reach a population that we just have not been able to reach in the past. And so I'm really excited that our field is becoming more and more recognizing of these amazing people who have really come, you know, really struggled and learned and are really heroes that they can, you know, share that with others. So that's been really exciting, I believe, in this field.
Me too.
Yeah, please.
Yes.
So good evening. My name is Elizabeth Tanner. I work with Hillsborough County Public Schools. And in terms of education, part of our mental health plan with the district is to provide youth mental health first aid training to as many teachers and district staff members and really all staff with this training. And it really encompasses talking about what is a mental health disorder with our youth, what are signs and symptoms, and how to assist the youth with getting to the resources needed to overcome some of those mental health disorders or issues. And during this training, and it's a 6-hour training, we talk about stigma, and we teach our teachers and our other staff members to really kind of how to break down those barriers that are surrounded with stigma, and how to embrace our youth and our children, and how to approach them and talk about these really sensitive issues. So I'm really excited that we're providing this training to many staff members. And you know, when we hit our teachers, they're not only teachers, they're mothers, they're fathers, they're aunts, they're community members, and they're going to become first aiders in our community. So I appreciate that.
Thank you so much. I was involved last week with the Hillsborough County nurses, so we helped provide some of that training as well. So yeah, that's great. So the next question, so follow up. I've heard that Florida policy is requiring mental health first aid training. So every person who works in all of our schools are getting youth mental health first aid training, right? And I know as part of that process, we had, I think last week, 8 to 10 trainers from the community. Other folks that are, how do you get those trainers, I guess is the question.
So we have a partnership with the National Council, and we have received funding through SEDNet, through our YMHAT funds, to onboard as many trainers in the district as possible. So we use our student services staff to become certified youth mental health first aid instructors. And then in turn, we will provide as many trainings, either during the school day or after school hours, to onboard as many first aiders as possible. So it's that partnership with the National Council that come to our county to provide that train the trainer session that we're able to provide so many trainings. And we had 22 instructor trainings, training over 350 health nurses last week, so it was a big feat.
Yeah, very great.
Real quickly, I just want to also say that there are, in order to be a trainer of youth mental health first aid, you have to do at least 2 trainings a year. Three trainings a year, and my agency has 2 trainers also, and we are actually looking for trainings to give. And so, so if you're interested in having a training, you can also contact me through the brochure and whatnot, because many of us who have mental health first aid trainers are actually looking for places to do training so people can keep up their certifications.
Thank you so much. We'd also like to acknowledge and are honored to have Mr. Andrew Warren here from the State Attorney's Office, and he's joining us for the last 30 minutes of our conversation. So thank you. So we touched on this a little bit in terms of treatment services, but another question, we have 2 questions about resources readily available to students who have suicidal ideation. So are there prevention services primarily for those students?
Yes, so we talked a little bit about forming those relationships and those bonds initially through some of our partnerships, such as Sandy Hook Promise, Start With Hello. We're also looking at See Something, Say Something, and pairing that up with Act Now. There are, at every single school, and a lot of people don't realize this, but every single Hillsborough County school has an assigned school psychologist, school social worker, school counselor, and maybe not every day. Most of our schools have a full-time school counselor, but I will be able to share with you that we have at least 133 schools slated next year for a full-time school psychologist. Many of those schools will also have a full-time social worker in addition to the full-time school counselors. So within the school settings, you have opportunities for different types of counseling groups to occur, for students who may have been identified with a disability and those who may not have, or those who may need some short-term counseling, or those who may need longer-term but educationally focused counseling. When it comes to differences in terms of more intensive therapeutic needs, then we do rely on our partnerships with community agencies. And so I'm going to ask Elizabeth maybe to talk a little bit more about the mental health grant and how the funds are being used for those partnerships.
So this past spring, we have partnered with Central Florida Behavioral Health Network and many of these sub-partners to allocate funds within the mental health grant per se, or legislation, the money that we received from the state, to provide direct services to students. So what we will do is have a referral process from the schools that will look at their student population, and through a problem-solving team determine students that may need additional supports outside of school. So this is an addition that at any school at any time they could make a referral to an outside community agency. But sometimes there are roadblocks for parents, such as insurance issues, transportation issues, you know, being an undocumented youth perhaps, where some of those hardships deter them from getting the services they need. Through this partnership with Central Florida, we want to take those roadblocks away and assist those families with getting services, either in the community, at the facility itself, or at the school. And through this contract and through these funding opportunities, we're able to assist families in that way.
Thank you. Along those lines, in terms of school support, what steps does the school district take to support students returning to school following a Baker Act or intensive inpatient care?
So Derek talked a little bit about our partnership and in cases where we have a children's crisis stabilization unit. So after a child has been Baker Acted, If the parent, as well as the child himself or herself, provide written consent, then we do have the discharge summary forwarded to the school district. We then immediately take that information and forward it to relevant personnel because it is confidential information. Everybody doesn't need to be privy to the details, but we want those school-based mental health professionals to have that information so we can partner with parents as well as work as teams to provide follow-up support. So we would like to have that in every circumstance. We just added on St. Joseph's, and Holly Say is our Director of Student Services in the room. St. Joseph's was added on this year. Baycare, which was part of St. Joseph's, or took over St. Joseph's. So we do have partnerships with even formerly Grace Points as well, Baycare now, and we're looking to continue to expand.
So, when a child is discharged and provided a counseling appointment, do you follow up? Does the treatment provider, does Grace Point or Baycare follow up and see if they actually went to the appointment? And so how do we know, basically, how do we know if they go?
So, a little bit of history. So it's a little easier to do when it's an internal affair. When we do have an agreement with Success for Kids, they send us a monthly disposition list of who actually engaged, who they couldn't get in contact with, and who just flat out said thanks but no thanks. So, you know, as far as our own outpatient services, we get a weekly report because we monitor that. They have 2 slot appointments a week to which they go to their follow-up appointment after discharge. So that's a little easier to intervene with. But when it's a private provider or an outside provider, that's a little bit more challenging to get feedback on those cases. So we are promoting that idea of, hey, you know, these are all our children, they're not just mine. You know, you're going to send these kids back to me at some point, maybe. We would like to have some dialogue, but it's not every provider that's willing to share that information. Does that answer the question?
Thanks, Darren. We have a couple, only more questions. What we're gonna do is, because we have about 10 more minutes, we have so many questions. Okay, I want to just ask this question because this is it's going to take another hour, but we have like 2 minutes, all right? In your opinion, why is Florida number 50 in the nation for access to mental health treatment? 30 seconds or less. Okay.
I'm afraid. I'm going to retract that. If there's a vote to expand in the say 275, it's going to be leading the 6 o'clock news. But if there's any discussion of mental health awareness, spending, priorities, you're never going to see that on the news. So we need to expand the conversation more, make it a priority. It's not some public policy issues like mental health, homelessness we deal with. Newspaper, it's not glamorous, it's not sexy for the elected officials. They need to get re-elected. This is my theory here. So go out there and advocate to your elected officials to make it a priority. I don't think change is going to come from Tallahassee or Washington and filter down. It's going to start from here and go up. So go out there and be heard.
Anybody else want to have a lasting comment on that one? That's a charged question. We can think about that. I want to acknowledge all of our panel members and all of our community here tonight. It's amazing to come together and to really think through some of these issues. I know we could go on for another couple of hours. We have other questions. What we'd like to do is wrap it up with our final 3 post-survey questions. Freddie, can you help me with our technology here? And then we're going to stick around for individual questions with our panel members. We have more food over here. We have resources on our tables on both this side and on that side.
Could we hear from our state attorney here before you
For a second, Freddie,
That's what you
Good evening, everyone. Can you guys hear me without the mic? Better with the mic?
With the mic.
My name is Andrew Warren. It is my privilege to serve as the state attorney for Hillsborough County. As most of you know, the state attorney is the elected countywide prosecutor, so the DA, as they call it on TV. I work with an office of 130 prosecutors, one of whom is here today, Lori Cura, who you heard from before, 300 total staff, and we're responsible for prosecuting essentially every crime that occurs in Hillsborough County, from the traffic offenses all the way up through murder cases. I know we're here talking tonight about juvenile mental health. Juvenile mental health. Two areas that are so ripe for reform within the criminal justice system. For too long, we have looked at criminal justice through such a narrow, short-sighted prism. We arrest, we prosecute, we convict, we pat ourselves on the back, assuming that we've done our job. Rather than looking at it through the much longer-term goal of how do we make our communities safer, how do we reduce crime, how do we keep communities healthy. So when we're talking about juvenile mental health, there's so much that we need to do differently. And we've started here in Hillsborough, and I know you've heard a lot of the answers. We have a tremendous partnership that spans not just the criminal justice stakeholders, the public defender and the judges and law enforcement and the state attorney's office, but into our school board and our nonprofit sector here. Let me tell you very briefly what we've been doing in the state attorney's office. We focused on actually giving treatment for people who suffer from mental illness, juvenile and adult, rather than just locking them up and waiting until they come back into our communities and then commit another crime, and we wonder why that happens. Working with our public defender and our judges, we have now set up not only an adult mental health court, but a juvenile mental health court in Hillsborough counties that are actually giving people treatment rather than just locking them up. That we're looking at how to solve the problem rather than just prosecuting and punishing people, especially for things outside of their control when we're talking about mental illness. But the work that we've done in this community in addressing mental health ends with the criminal justice system. It doesn't start there. It started with all the work that you've heard that's being done today. In the homes, in our communities, in our neighborhoods, in our schools, with law enforcement. I give tremendous credit to Sheriff Cronister and the Hillsborough County Sheriff's Office for embracing the crisis intervention training that's going to be required of all officers. So now, when we haven't solved that issue in our home, when we haven't solved that issue in the school, when it arises to the level of an emergency incident on the street, we are training all of our deputies to reduce the likelihood of the deputy and the person in need of help ending up being harmed. This training will reduce fatalities for law enforcement and for members of the community. And when we still can't solve the problem through all those avenues, and then cases end up in the criminal justice system, we have to embrace that same approach that everyone else has. Problem solving. What is the problem here? We have a young person who is suffering from mental illness, who needs treatment rather than punishment. And that's why we're so proud of the mental health courts that we've established. That's why I'm so proud of the partnership we have with the Public Defender's Office. It's why I'm so proud of the support we have from the judges. We are changing the landscape here in Hillsborough County of how we're dealing with mental illness. Now, we have not solved the problem yet, and we're not going to solve the problem. But I tell you, we are along the right path to doing things the way we should be, to building a safer, stronger, healthier community. Thank you.
Thank you, Mr. Warren. So, we want to go and do our surveys again. Here we go. Do you know how the Baker Act works? Did we do our job? I guess we did 100%. Are we still going? Oh, they're coming in. Can we end it now while we're doing that?
Yeah. Let me take that win.
Very good. All right. Do you know how or where to get help if your child's family is in crisis? again, for those of you that are not sure, please stay after, and we have a lot of resources, so we want to make sure that you do know where to go to get help. Third question, would you feel comfortable if you had to use the Baker Act? Okay, interesting. So again, if you have questions after our panel members, we welcome those questions, and we really appreciate all of your attention and your community support, and again, acknowledging our panel members over time.
So everybody, I need to just do a wrap up. I got to listen to what the questions were, what our answers are, and I think I can identify some next steps, or at least some things that have been, that have come to light in this little session. First of all, please take up Success for Kids and Families on youth mental health first aid. It's a transforming thing for you to do. It takes a youth who appears to have typical normal child issues, and this vignette will take you to a place where you need to identify issues and act on them on behalf of these children. If we're really serious about stopping stigma, promoting awareness, and educating ourselves, that in particular is an awesome opportunity for everybody. And if it's being offered, thank you so much, Miss Italian, I'm Italian too, because I would please our community members take her up on that. Secondly, we all saw the data. I wish that Dr. Christie got to come up 10 times because she's brilliant with it.
I'm Italian too.
The numbers are large, but whether that means something good or something bad. I mean, we're identifying kids more than we've ever done. That is a good thing, so maybe those numbers aren't bad. But at the end of the day, 50th in funding is not acceptable, and I think Officer McDonald is going to ring in our ears for a long time. Let's all be nags. Now you're waiting for us. Please, community members, get involved. Number 3, I heard this, I think maybe others heard it too. I don't think police officers want a Baker Act. They're not clinicians. They don't want to handcuff kids, put them in police cars. And they don't want to Baker Act students. Hillsborough County Schools wants to collaborate with law enforcement so we can take care of our children. There's an inconsistency there. So what can we do differently? How can we address that, and how can we problem solve to do something different? And I have a suggestion based on other points that you all brought up. Over-reliance on the Baker Act to get services for our kids. I think that's what we're all talking about. We're over-relying on law enforcement needing to do Baker Acts regardless of alternatives. I've been totally impressed. Thank you for your presentation, Miss Townsend. You're always going to be a doctor to me, sorry. I'm totally impressed that our police officers are the ones sitting here telling you the efforts that they make to come up with less restrictive treatment alternatives. So kudos to them. Negative experiences, and I appreciate that from the community, because I know every one of you are here, have a story, and have something in your heart that might not have gotten communicated today. So I hope that at least you know that this community's attempts to work with each other to do the right thing is actually a very important part of the community. It's a privilege to work for the criminal justice system, the court, Ms. Julianne Holt, Mr. Warren. I work in that juvenile mental health court. We're trying so hard to change outcomes one day, one kid at a time. When you have a kid coming into court and what they say and what their families say is heard by a judge, and a judge comes off the bench and gives them a bear hug and tells them they could be somebody better and they can have a life and there's hope for recovery, that is a gift to be part of. So when we talk about over-reliance on the Baker Act, safe and sound, this isn't one and done. Our committee is committed to doing this again. And whether you would come back and join us or bring your friends, I think it would be very important that we sit as a group and map our community resources that could be alternatives to the crisis situation of a Baker Act. Does that sound like an idea for the community? Would you be interested in participating?
Oh, yes.
All right. Well, I want to thank you on behalf of Freddie and all of Safe and Sound. This is a special night for all of us because we're talking. And until we talk about things, we won't have change. So thank you so much for being with us, and please take advantage of the resources and the people here to chat with you.